Hey, folks, if you want early access to episodes as they drop, click that subscribe button, join us, and together we'll fix the broken U.S. healthcare system. We'll see you on the next one.
Get ready to take control of your healthcare. Here's your host, Ray Cobra.
And we're live. Ladies and gentlemen, welcome to Broken Healthcare. My name is Ray Cobra. I am your host, and today we're joined by Thomas Johnson, a seasoned healthcare policy expert who's been at the forefront of understanding and navigating the 340B drug pricing program. Thomas brings a wealth of insight into how this decades-old program was designed, how it's evolved, and where it's now facing controversy. From the intended mission to the unintended consequences, Thomas will help us cut through the noise and uncover what's really happening in the world of drug pricing, hospitals, and the middlemen shaping the system. Get ready to have your eyes open. Here we go, baby. Welcome to the big show, Thomas.
Thank you, Ray. Appreciate it.
Oh, hey, it's so great having you here. And ultimately, I think everybody knows that the drug game is a little messed up in the U.S., right? Unless you've been living under a rock for the past, 10 years or so, you know that there's just something that doesn't smell right in Denmark. So before we get into what we can do about it, I'd love for the audience to learn, as I learn, a little bit more about you. Where did it all start with you? You know, we spoke a little bit before we jumped in, not too long, and you grew up in the Maryland, D.C. area. That's kind of where you were born and raised. What was little Thomas like?
Little Thomas was always interested in politics.
Is that right?
Yeah.
You're a strange kid.
Yeah, strange kid. That's right. But, growing up in Washington, D.C., I think we all assumed politics was part of our life, both locally and nationally.
Yeah.
Where I went to school with some people whose families were politically well-connected. Went to school with Eleanor Mondale's daughter.
Okay.
Vice President Mondale's daughter.
Right.
Classmate of mine is Congressman Jamie Raskin. So I think just kind of the nature of the school, we understood what politics was about. I went to private school in D.C., and it was the first private school to integrate in the area, and it integrated in the 50s, even before, all the civil rights laws started passing and things of that nature.
Wow.
I think that mission was instilled in all of us, and just came kind of naturally to me.
Did this come from mom or dad, or who was driving this back on the home front?
Probably my father a little bit more.
Yeah.
My parents were born in Georgia, both kind of rural parts of Georgia.
Yeah.
And they moved to D.C. for better life.
Okay.
My father, he only had a 7th grade education, but he started his own business, first as a bricklayer, but then doing foundation work for a lot of housing developments. And so I think the opportunities that were presented to him in D.C. Really bore his interest in politics. And so I would say that's where I got that from.
Yeah, that's cool. And, so you're an attorney by trade, if I'm not mistaken?
That's correct.
And that doesn't come easily. I've interviewed so many doctors on this show, and to think about what they go through, because I think almost culturally from the outside, I don't know if it's the old, Jewish joke, you can't be a doctor or a lawyer, you'll be an accountant.
Right.
Right? So we kind of lump those two professions together. But honestly, like the training involved in being a doctor is just it's beyond. It really takes a huge commitment. But that takes nothing away from our attorneys, because that's also quite a commitment. Not everyone could cut it. You got to pass the bar. That's a dog.
Yeah.
And but from a very early age, it was kind of instilled in you. You were surrounded by politics. You went to school with the children of politicians. And I guess it was just a natural. Did you know early on that you wanted to be a lawyer, or is that something that kind of came later?
I think early on I knew I wanted to be involved in politics. When I became a senior in college, I was a political science major. I don't think I was ready for the real world.
Who is when you were a kid?
Right.
Right.
But my cousin was a assistant DA in Macon, Georgia, and really had a lot of influence over my life. And so I said, hey, let me go to law school.
Okay.
Maybe hone some of my skills and thoughts a little bit.
Right.
And it's a great education whether or not you want to be a litigator.
Yeah.
And while I was in law school, I had a number of internships that were related to government affairs, one with the ACLU in their Washington office, and got involved with some issues there. And I think I decided at that point, this is what I want to do.
Interesting.
Yeah.
And so from there, what would you say when you look back at your career, because you didn't end up where you are now, what were some of the early experiences that you think shaped your path and led you to where you are now? When you look back and you say, I really love it or hate it, and I'm not putting any words in your mouth, I want to learn from you. This experience really taught me a lot. I learned a lot here, and that really helped me moving forward. Or was there none of that?
Yeah, I'd speak to two things. Number one, when I was working for the ACLU's Washington office for the summer, the Reagan administration held hearings on pornography. And I worked for a First Amendment attorney. So obviously you knew what their position was.
Right.
And, we were they had a hearing and we were the loners in the audience. But I just thought that...
publicly facing anyway.
Exactly, right. But I just thought that experience, it really kind of moved me,
Yeah.
The gentleman I worked for, you might remember him. His name is Barry Lynn.
Okay.
And he ended up leaving that organization to form Americans United for Separation of Church and State. And he was a reverend by nature. And so he spent the majority of his career actually running that organization and making sure that those lines weren't crossed between church and state.
Right.
But at that hearing that we had, and we had some back and forth about pornography, I just said, okay, this is what I want to do. So that really kind of inspired me and said, okay,
yeah,
I know the direction I want my
Well,
career to
it
go.
doesn't sound like it makes for a dull day at work.
Exactly.
Right.
Exactly.
So, not being up to snuff on the details, I think we all kind of know how that panned out. And I think these are some of the tough questions that we ponder as Americans, because there's always a fine line between government and morality, or government and just decency, I suppose. And if you kind of lean towards the side of morality and decency as the government is concerned, be careful for what you wish for.
Absolutely.
Right? It's almost like a law of the universe. I always say the universe really, maybe it's the father of math. You cross over that equal sign and something's going to change.
That's right. That's right.
And so, but it sounds to me like this is, and I'm reading into this here, but I feel like it stoked a passion in you.
It did, and I think the thing that I think we all have in common, whether we have differences on issues or not, is that we have the freedom to be able to work on forming a more perfect union. And so that's kind of what I think in a lot of cases politics is all about. Not arguing right or wrong on an issue, but the fact that people are working on something to hopefully make things better, I think is a common goal of a lot of people. Now, they might disagree on what's better.
Right.
And if certain people deserve that or if they don't deserve that.
Right.
But the fact that they're working on it, I think is something that we all share, whether you are, working in Washington, whether you're working at the state level, the local level. I've worked at all three levels. I think that thing kind of carries over. And I know it can be hard. It can be very intense.
Yep.
You can be villainized for taking one side or another.
Yeah.
And during that hearing, I felt like we were kind of villainized in a lot of ways. But at the same time, I understood what Barry Lynn was fighting for. He was fighting for a certain amount of freedom for Americans. So, I really appreciated that. And so I try and take that passion, into my work. And when I'm delivering messages, representing whoever I'm representing at the time.
Yeah, when you say so, Barry Flint, I'm not familiar with. I thought the name that was going to come out of your mouth was Larry Flint.
Okay,
because I believe there was another famous case.
That's correct.
Involving that character. But I guess when I speak to someone like you that's had that experience, what comes to mind to me is often in life you feel uncomfortable at times. You're going to be in situations where you're not the majority, or at least you certainly didn't feel like the majority in that room.
Right.
And that's really where character is made. It's sticking to your convictions, regardless of what the popular opinion is, or kind of going with the flow and consensus. And I think those moments are really where the gains are made.
Yeah, I had the unique experience of being on both sides of one issue during my career. While I worked for the Medical Society of D.C., we were able to get the City Council to pass the first comprehensive anti-smoking ban in the country. And that was an accomplishment for me early
that was you?
Career.
That wasn't Mayor Bloomberg?
That was D.C.
Wow.
Was D.C. A couple of years later, I was representing the Montgomery County Chamber of Commerce. And there are a lot of restaurants in Maryland and Montgomery County. So you can imagine what position they wanted to take.
Right.
And so I remember walking into that hearing and seeing a lot of the people that I stood with in D.C., and they're like, "Oh, Thomas, you're here to help us out." And I was like, "Well, not exactly."
Great.
Right. And it was interesting because my law school professor was actually one of the Montgomery County Council members.
Oh, wow. And
he let me have it.
Did he really?
He did, but he said you stood your ground.
Yeah.
And he said that's what we taught you in law school.
Okay.
So that was a learning experience for me.
Yeah, and we're pretty much the same age, same generation, certainly. When you think back to when we were, teenagers coming into our 20s, and you're first, going out to bars and restaurants and clubs, that was just the way things were back then.
That's right.
Right? It was, you would walk into a smoke-filled restaurant, and it's what it was. And could you imagine going back to that now, though? It at the time, everyone was up in arms. It was you're killing my firstborn here.
Yeah.
But in the reality, big picture reality, how much better is it now?
Oh, it's much better. And I'll tell you a funny I'll tell you a funny story. Right after we got the ban passed in D.C., my wife at the time and I went to a concert. And the artist, right in the middle of a song, said, "I understand y'all passed a smoking ban in D.C. Now, who the hell is in favor of that?" And so my wife kind of points at me like, "Oh, he did it," So that was kind of funny.
That's hilarious. That's pretty cool. So yeah, it's crazy because in the moment you're weighing these things and what's the big deal and this and that, and after something like that gets passed, then put aside just the common sense of making that move, right? It's just so much better for everyone.
Mm-hmm.
But just think about your clothes and taking them off after going to a restaurant that was filled with smoke or a nightclub filled with smoke. It's just amazing, and your clothes are reeking of this.
Yeah, absolutely.
What's going on with your skin, the biggest organ in the body, and
Right.
never mind everything else.
Right.
So,
That's absolutely right.
thank you for that. Appreciate that. So, tell us about the organization that you're with now. Is the CEO the proper title?
Executive director.
Executive director, and tell us, what is the name of the organization and what is the mission?
So we're called the Alliance to Save America's 340B program, or ASAP 340B. We came together about 2.5 years ago.
Mm-hmm.
And primarily, we came together because there were two groups that wanted to start the motion of discussion about addressing some of the problems that were emerging from the 340B program. Pharma and the National Association of Community Health Centers.
Mm-hmm.
And so they started having discussions, primarily because the hospital community did not want to talk about this program. They didn't want to see any changes.
Mm-hmm.
They didn't want to talk to pharma, and they didn't want to talk to the clinics either. So the two groups, being kind of strange bedfellows, which happens a lot in politics, they decided to talk to each other and reach out to some other groups to form this coalition. We started out with 15 members of our coalition. We now have 36. We continue to grow. I'm sure in the next couple of months we'll be up to 40 members,
Mm-hmm.
and we'll still continue to grow as well.
What types of members?
We've got different types of groups. We've got provider groups. We've got consumer groups. We've got groups that are focused on aging. We've got groups that are focused on kind of issues related to people of color. It's a real diverse group that we have.
Mm-hmm.
We have nurses. We have physicians. We have the National Consumers League that represents consumers.
Mm-hmm.
It's just a really wide variety.
So it may help if we back up a little bit and talk about what 340B is. And, it's crazy. I know 340B pertains to legislation,
Yeah.
yada, yada, yada. We use numbers and these, arcane descriptors. In plain English, what was the 340B plan designed to do? I believe it was introduced in 1992.
Yeah, it was introduced in 1992, but the issue itself really kind of started before then.
Okay.
So there were manufacturers that were providing hospitals drugs at a discount price voluntarily.
Okay.
And that price was hovering around 9% or so of the market price for the drug.
Mm-hmm. 9% of.
9% of.
So if a drug was $100, they were selling it for $9.
That's correct.
Okay.
That's correct.
Wow. That's a deep discount.
That's a very, very deep discount. So in 1990, the Congress passed the Medicaid drug rebate program.
Okay.
I was actually at another organization, Medicaid Health Plans of America, at the time. And so the drug rebate program was designed to provide a rebate for drugs in Medicaid, and those drugs primarily were controlled by Medicaid health plans, Medicaid health insurance companies.
Mm-hmm.
Unfortunately, the way the statute was drafted, the effect of certain language in the statute actually made that price that hospitals were receiving a discount for quadruple, up to about 32%. And so 2 years later, they passed this 340B program to try and address that correction and add other types of covered entities that could receive discounted drugs under this program. So that's when the program was created in 1992.
And the aim of the program was to provide relief to hospitals with the idea or the notion that that relief would then be passed on to African Americans, people that were on the Medicaid program that were relying on federal assistance. This 340B program was really designed to offset the cost of their drugs.
Yeah, it was designed to help people who were underserved, living in underserved communities.
Right.
Whether they were on Medicaid or whether they actually had private insurance.
Okay.
So now, essentially, what happens is that discount is 59% of the market price.
Okay.
Hospitals, clinics, and other types of entities can participate in it. Manufacturers have to participate in the program if they want to be in Medicaid and provide drugs to Medicaid entities. And so because these entities serve the underserved, they have scarce resources, this drug is provided at a discount so they can distribute those drugs to the people that they treat and serve. And so that's the nature of the program, and it's a very, very well-intended program.
But Thomas, what happened? How did we get from 9% to 59%? That's a 6x, difference. And I'm not a conspiracy guy.
Yeah.
But I think there's so much wonderful and great about this country, and I wouldn't trade it for anything. But there's so much bullshit going on too. It's just the reality. How do you get from A to B?
Well, understand this. There's a formula that essentially sets the price.
Okay.
That formula didn't exist when the program was voluntary.
Of course it didn't.
But what I would say is 59% is still a substantial discount for the price of a drug.
So it's a 59% discount as opposed to a 92%. 91% discount.
Exactly.
Got it.
And you have many, many, many more covered entities in the program than you had before when you just had hospitals in the program. I have clinics and Ryan White clinics and all other types of entities.
Right.
So all of those things are balanced out. And believe me, they still enjoy the discount.
Yeah.
It's a substantial discount, and our coalition supports the program, and we want to see the program continue.
Yeah, because it does sound like it's well-intentioned, right? If we can help get these drugs into the hands of people who desperately need them and can't afford them, that sounds like a pretty solid mission. But where do we go off the rails? And are there checks and balances in the program so that if you have an entity that is benefiting from the program, we can kind of follow the money, if you will, and go back to the person who is underserved, underprivileged, that we're impacting and benefiting them? Do we have such a check and balance in place now?
We do not. The only thing that resembles any type of check and balance is if an audit, which used to be performed by the Office of Pharmacy Affairs, and now it's going into CMS, if an audit was performed and they found some irregularities.
Okay.
Outside of that, there really weren't any checks and balances. You just relied on the statute and whatever regulations may or may not exist. And understand that for the most part, we're talking about a statute that's over 30 years old. There were some minor changes when the Affordable Care Act passed that allowed for some more covered entities to qualify for the program. But by and large, there haven't been any other types of substantive changes to the program, and it's grown.
Yeah.
It's grown substantially.
How much money are we talking about? How much money flows through the program?
Well, if you talk about the market price, the last year that we were able to track such numbers was 2023. And so you're talking about $126 billion. You're talking about $66 billion is the actual spend within the program.
Wow.
And that is divided up, 87% of that is with the hospitals.
Wow.
The next largest category is 5%, and those are with the community health centers. So this program has tilted way towards hospital systems.
And you're talking per year?
Yes.
2023 is the last recorded data that we can track.
That's right.
And if you were a betting man, would you say it's gone up or down since then?
It's gone up every year. In fact, it went up. It went up over 23%.
Right.
Between 2022 and 2023.
Wow, that's huge.
And that's been the trend lately, unfortunately. 20% is the average growth in the program.
Could you imagine having a $120 billion business and having that business appreciate by 20% a year?
Especially if you don't have a lot of oversight.
Right.
And so, I mean, I've represented different types of providers during my career, and one thing I know is that they hire expert people,
right,
who know a lot about reimbursement,
right,
and they look at what is in the law and what the law does not say. And so
they play in the gray area.
The hospitals are great at this.
Yeah.
Okay.
Yeah.
And so there are practices that have been adopted that we think not only have led to the growth of the program in some ways, but even more so, I think, led to abusing the program and getting away from the program's mission. And I would say those things really motivated our coalition to come together.
Right. So what was it? What was kind of your eureka aha moment where you said, this is a wrong that I want to right?
When I was presented with two articles, one was by the New York Times and the other was by the Wall Street Journal.
Okay.
And what they showed was these large facilities, and we're talking Bon Secours, we're talking Cleveland Clinic, were closing some of their facilities in underserved areas. They were opening new facilities in affluent areas. And they were extending the discount to those affluent areas.
No.
Okay? All legal.
Right.
Under the law.
All legal under the law.
But getting away from the mission of the program. And there was one now late congressman in Richmond, Virginia, who indicated, African-American congressman, who indicated, this was an issue for him.
Yeah.
Even though he supported Bon Secours, he was going to try and look at some legislative action to try and keep this pattern from taking place. And I really think that he was the one that, in recent years, kicked off the reform effort.
Well, and who's to say if there's little oversight that they're procuring the drugs on behalf of patients in affluent areas and charging them full price and keeping the spread?
Well, full price would be ideal.
Right.
What we have found is that some of these hospital systems are actually charging 500 to 1,000% of what they acquired the drug for.
My goodness.
Okay?
Wow.
So now you're getting outside of the scope of the program.
Right.
There wasn't any issue with, in our opinion, a covered entity acquiring that drug for 59%,
Right.
distributing it to patients, and holding on to that 41%. We did not have an issue with that.
Mm-hmm.
But we do have an issue with 500 to 1,000%
Right.
markup,
Right.
arbitrage, whatever you want to call it.
Sure.
That sounds like something else. That sounds like interest rates you buy used cars at, at a 50% interest rate.
Right.
That really goes against what we think should happen in these underserved areas.
Oh, without a doubt. And when you hear stories like this, it's no wonder that we have a podcast called Broken Healthcare.
Yeah. Oh, yeah.
Because the reality is we're spending now $5 trillion a year. It's an economy that's hard to comprehend. It is really gotten way, way, way out of hand, 20 cents of every dollar we spend. And so there really needs to be accountability. And I don't know what the balance is, because I'm sure on the flip side we would have hospital administrators that would say that they are operating according to the letter of the law, quote unquote, and they very well may be, although they're certainly not operating in the spirit of the law. And those two things, are not mutually exclusive.
That's right.
And so, and they may have other parts of their budget which they are required to subsidize,
Right.
to keep their lights on and their doors open,
Right.
and therefore use a program like 340B to subsidize theirs, kind of begging, borrowing from Peter to pay Paul.
Sure. Mm-hmm.
But something somewhere has got to give.
Well, I think one of the things that needs to give, if that's the case, then just be transparent about what you're using the money for.
Yeah.
Okay? So we can really get a clean picture as to the needs that you have as a hospital. Because in the statute, there are no specific transparency disclosure requirements about what you are spending the 340B dollars for, or even how much you are receiving. Okay? So hospitals essentially have been spending the money. I'm not going to say all hospitals, because there are some good stewards. But hospitals have been able to spend money on things like capital improvement projects. That's not healthcare.
Right.
There might be some value to it, but that's not healthcare.
Right.
We've heard stories about a Super Bowl ad being purchased by a 340B hospital.
A Super Bowl program.
In New York. Okay? Those ads run at about $8 million this past year.
Wow.
We've heard stories about a football coach's salary being paid for by 340B dollars. And, I would venture to say, literally everybody that I've told those, stories about, nobody can defend that.
A Lamborghini?
Yeah,
An evil Lamborghini?
Nobody can defend that. And I don't think anybody really wants to see that happen.
That's egregious.
But those type of things can happen.
Yeah.
Because once again, you don't have to report what you're spending the money on.
Right.
And there are no requirements to either reinvest in the facility or spend it on health care. Now, under another statute, the community health centers actually do that very thing. They report their 340B dollars. They show that they're reinvesting their money in health care. So what they do is really a model that we think all covered entities should follow. And again, they're only getting 5% of these dollars. But, every dollar for community health care from community health centers is vital.
Sure.
So those are the types of what we feel are reasonable.
Episode of Broken Healthcare Podcast is brought to you by Benefixa Healthcare Consultants. Visit benefixa.com to learn what's possible. Reduce the cost of healthcare for your organization, deliver better outcomes for your people, And yes, design health plans that give your people a path to $0 out-of-pocket costs for healthcare. Visit benefixa.com today. Well, why is there accountability there, or is it self-imposed? Why is there accountability with a community-owned health center versus a hospital?
Because they have different statutes that they have to comply with, and so they're not reporting that because of the 340B statute.
Right.
They're reporting that because of another statute.
I see.
That they have to show how they're using those dollars
Right.
that they receive.
Transparency seems to be the key to so many of the issues that we face in D.C. Really just distilling it down to what was this law, what was the intention, what was the spirit, is it being abided by? And I guess on the other side, if not, what are the consequences? What are the consequences if a hospital is audited and they're found to, I don't know, pick a number.
Right.
Let's say they have $1 million that they can't account for, that they didn't appropriate properly.
Right.
What's the accountability look like?
They can be kicked out of the program.
They can be kicked out of the program.
Yeah. In fact, there was a hospital I just saw just a few days ago that was kicked out of the program by HRSA. So
not
there's true accountability there. You know, if you see something wrong that's happening.
So not retroactive, punitive type of damage, but certainly the value of the program is tremendous, and to be kicked out of the program, they're losing a tremendous amount of
absolutely, because all of a
tremendous amount
sudden
of revenue.
Those costs now go up.
Right, way up.
Yeah,
Way up.
yeah.
Wow. So your organization primarily is focused then on what?
We're focused on reforming the 340B program. We've got 10 policy principles that we've adopted as a coalition, including some of the things I talked about.
Yep.
And they're really kind of based on clarity, transparency, and accountability.
Okay.
We think they are very reasonable. We draw a lot of our policy recommendations from what other types of counter entities are already doing, what clinics are already doing in many, many cases.
Yep.
And we think they're very reasonable. Now, if you talk to the hospital community about that, they have a different opinion, obviously.
Yeah.
But understand, I mean, both manufacturers and clinics have relationships, with hospitals.
Sure.
On a day-to-day basis.
Sure.
But I think they want to see clarity, transparency, and accountability in this program.
What does that even look like, Thomas? If we're talking about your little old organization against the hospital systems, I know for a fact that two of the biggest real estate owners in New York City and Manhattan are NYU and Columbia.
Yeah.
They own a tremendous amount of property.
That's right.
That's primetime real estate. They got to be worth a couple of bucks.
Right.
So as impressive as your background is, you're one kind of small little entity, not meaning to disparage you in any way, going up against these juggernauts.
Yeah.
What does it look like on the Hill when you show up and you you look over there and you have these monsters that have a different point of view?
Well, I think that's why we focus on those three areas. It's really hard to make an argument against transparency. I mean, that appeals to the average person.
Good point.
Whether you're in healthcare or outside of healthcare.
Yeah.
And understand, this has now grown to become the second largest prescription drug discount program in the country. Okay, so this is not a small program anymore.
Yeah.
And literally, I've talked to audiences that are not in healthcare, and they want to know how these dollars are being spent.
Right.
Especially at a time when now, there's been a bill that's been passed by Congress and signed by the president, and a lot of entities need to look for ways to find more money so they can spend it on health care, not capital improvement projects or things of that nature, but they can spend it on health care. And, 340B may be a place where you can find some dollars to spend on healthcare and not things that don't relate to healthcare.
How does it impact business? Does it impact business? If I'm listening and I'm the CEO of American Express, do I have an interest in this?
Yeah. In fact, there was a group of 25 large corporations, including Bank of America, and other groups called the Global Council on Aging. And they actually just released a report talking about how the lack of oversight with regards to the 340B program is affecting the business community. The American Benefits Council released a similar report in February of this year because private employers are also affected by the lack of transparency and oversight as it relates to 340B. Not only are Medicaid and Medicare being charged these 500 to 1,000% prices,
Which is astonishing.
but private payers are being charged as well.
Right.
And so that affects employers. I just talked to the A. Philip Randolph Institute, which is an organization that represents kind of African American labor. And they've come out with a statement asking for reform of the 340B program.
Oh, wow.
2 years ago, they weren't there.
Right.
I spoke to them 2 years ago.
Right.
And last week when I spoke to them, they now have a position as it relates to 340B reform.
Okay.
So that's labor and that's a business community recognizing the impact in the private market.
Sure. Well, what folks need to realize is that healthcare is a business with a supply chain.
Absolutely.
And if 80 to 85% of what we spend in healthcare is claims related, and we now have hospitals primarily that are gouging the system and taking advantage of every loophole that they could find, even though it may in fact be legal.
Sure.
It's costing us all dearly.
Absolutely.
And so this is important for really all stakeholders to understand. While the program and what I'm hearing is intended for underprivileged folks that may be subsidized with Medicaid or Medicare, maybe not in those programs, that are just kind of barely making it, and they may be in another ACA program or have some other type of coverage. They're not getting the full benefit potentially that they should be getting. So yes, it's impacting them, but we're all paying a price for it.
We're all paying a price for it.
I mean, the numbers are staggering.
Yes, they are.
If we're talking about that growing at 20+% a year, my God, where does it end?
It will be in the next, I would say, 2 to 3 years. It will be the largest prescription drug discount program in the country.
Wow.
And for there to be no transparency for a program of that size is really alarming.
Are you optimistic? Do you think we'll get to a place where we can kind of, clean the glass and see through it?
I think that there is some bipartisan support for some type of transparency or reporting measures. I'm not going to say that we have arrived at the specific conclusion of what that is.
Yeah.
But I would say that even there are even voices in the hospital community that kind of realizes, well, if we've got to give up something, maybe that's where we should give something.
Right.
And I would certainly think that would be a start in terms of reform.
Yeah.
Senator Bill Cassidy is chair of the HELP Committee. He came out with a report in April calling for reform of the program.
Yep.
And he wants to try and do something this congressional period to reform it. There are 6 senators working on a comprehensive reform measure that hopefully they introduce at some point and try to help get through the Congress.
Yeah.
A number of them sit on the HELP Committee. And on the House side, there are numerous proposals. We have, in the past, supported a bill called the 340B Access Act. Was introduced by Representative Larry Bucshon in the last Congress. And my understanding is that that will be reintroduced shortly.
Okay. So there is movement. We're seeing a little bit of a wiggle.
I think there is movement. I mean, I would say that probably 8 years ago, no shot.
No shot.
But I think as these stories continue to come out, as reports continue to come out, the Lupus Foundation and the Arthritis Foundation just came out with a joint report calling for reform of the 340B program. I think as those things continue to happen, there are more voices that I think are effective in calling for reform. I think our coalition is part of that.
Yeah.
There are other groups that are trying to work out some solutions. But, you know, it's time.
For sure, it's time.
Yeah.
So as a DC insider, someone that has kind of been there your whole life, you've kind of grown up around it. How do we change things? How do we get things to be adhered to transparently from the get-go? And I got to tell you, I'm really frustrated and a little pissed off that our system seems to have these actors that are elected officials, our politicians, that are not only selling you and me down the river, but their families, their friends, their neighbors. There's so much payola going on.
Yeah.
It's really disheartening. And what's it going to take? Do we need to get to a point where someone is made an example of?
Yeah.
Because again, I think what I'm seeing, and I've spoken to several folks that run in your circles down in the DC area, and it's not that anything illegal is happening, quote unquote, right? So, okay, great, gold star, you're coloring within the lines, but that shouldn't be acceptable, coloring within the lines. If you're profiteering somehow and you're not making a decision based on the facts for your fellow Americans, but there's some other mechanism that is motivating you, that's just wrong.
Well, again, I think that's where transparency comes into play.
Yeah.
Because, you know, this is just my opinion. I think that those two articles by the New York Times and the Wall Street Journal about some of those practices that I talked about, I think they were devastating for the argument that they should not be reformed. I think they helped bring our coalition together. And, you know, unlike what, you know, happens in a lot of cases in Washington where somebody puts out the study and they're like, oh, you know, well, you paid for the study's biased.
Right.
You know, blah, blah, blah. You know, this was the New York Times and the Wall Street Journal, so you can't say that, you know, any of our members, you know, paid for that.
Sure.
You know, that's transparency in action.
Right.
And, you know, anybody who argues against transparency, you know, you have to wonder about them a little bit. But I think those things motivate people.
Yeah.
I mean, we're still a democracy. You know, we still elect our officials.
Yep.
We should be holding them accountable.
Yep.
And, you know, from my experience, while, there's a lot of influence, I'm going to call it, for lack of a better word, in Washington, people got to get reelected.
Yeah. Yeah.
You know, they still got constituents.
Yep.
You know, so, you know, it's always refreshing for me to speak outside of the healthcare audience about this issue.
Yeah.
Because you see real reaction to it. The first group I spoke to about 340B reform was a group of African American ministers in New Jersey.
Okay.
A couple of years ago. 90% of the people in the audience did not know anything about this program. They never heard of it.
Right.
And by the time I finished my presentation. I mean, they were angry,
Yeah. Sure.
and their representative was Frank Pallone.
Okay.
So a number of them were like, well, I need to call my representative.
Get me Frank.
Exactly.
Right.
That comes with education. That comes with transparency.
Yeah.
You have to think now. I mean, people have, access to so much, in this information age that we're in.
What about the term limits for our congressmen and our senators?
You're asking me.
I really would love your opinion. You're gonna make some enemies today.
Yeah.
What? Come on. What is the standard term limit for a senator?
Well, okay. This is not my 340B hat. Let me just make that
take
clear.
that off.
I'm still of the belief.
Yeah.
That
Mitch McConnell had a freaking stroke for crying out loud.
I understand, but I'm still of the belief.
Yes.
That if the people put someone in office,
yes,
they should take them out of office. That's just my personal feeling. I don't think anyone else who's on the other side of that is wrong.
Right.
That's just my personal belief.
Yeah.
Yeah.
I think we need to be more involved, and I'm speaking for me personally, in politics.
Absolutely.
We're not. I'm not. I'm so unplugged and out of touch, and I'm much more plugged in as I get older than I've ever been. I'm paying more attention.
Yeah.
But the fact of the matter is, we really need to educate our young people.
No question about it.
To get involved and understand what's going on, because it can't do any good to have an elected official in office for decades. I'm sorry, but the position needs to turn over. We need fresh blood. If for nothing else, just as a prudent accounting method.
Yeah.
And folks should know that, they're yes, we appreciate and we respect your service, and serving is a privilege.
Yeah.
Treat it like that.
I always, I would tell you, I generally agree with you.
Yeah.
But I do think there's some value in having some historical presence and knowledge as well.
Right.
And having maybe a mixture of the two.
Mm.
Just so that,
but
if anything...
let him be a consultant. Not to cut you off. Let him be a consultant, but not someone with voting power.
Yeah.
Because, I mean, come on, man. It's I don't want to go down the road of Nancy Pelosi having, hundreds of millions of dollars on a salary that's less than $200,000 a year, and where did that money come from?
Yeah.
And not to pick on Nancy, but it's fucking everybody.
Yeah.
And so, come on, like the rank and file, the folks that are going into those voting booths to vote, need to do a better job of educating themselves and understanding who they're voting for.
I absolutely agree with that. And what I will tell you is that, very early in my career, I worked for an elected official. Mm-hmm. Now, this is a member of the Council of the District of Columbia. Mm-hmm. And I can tell you that, now this was just little old D.C.
Yep.
But when people called, or if they came into the office, we paid attention to them.
Yeah.
It's amazing to me, again, in this information age, it's amazing to me how many people just won't pick up the phone and call their member of Congress or visit them. Mm-hmm. It's just amazing to me.
Yeah.
And I mean, that's what they're for.
Yeah.
They're making decisions about this country, about your tax dollars.
Right.
And so when issues like this come up that I represent, one of the things that we plug into is not just the healthcare interest, but consumers as well. The National Consumers League is part of our coalition. medical debt is a big issue that we see should be addressed in 340B reform.
Number one cause of bankruptcy in the U.S. Over
Absolutely.
100 million Americans living with medical debt.
Absolutely. And I believe it's the largest fundraiser for GoFundMe fundraising at this point.
I'm not surprised.
I've got many friends in the restaurant industry and other industries. You know, when they get sick, something happens to them.
Yep.
They set up a GoFundMe page immediately.
Yeah.
If we have that type of information age, why can't you, instead of talking about them on
Right.
Facebook or texting or wherever,
Right.
pick up the phone or go down there and see them?
Yeah. And I think the answer is people don't know or aren't inclined to be involved. And I'll give you a personal example. So we have another home further out on Eastern Long Island in a very small community. And our neighbor across the street is a senior gentleman, former Marine, retired, dedicated his life to service as a paramedic and fire department, phenomenal guy. And we have community meetings, and he's the guy who stands up, who preaches to his fellow neighbors, get involved. Go down to the town. You listen to these committee hearings. Have a voice. Have an opinion.
Yeah.
Nobody goes.
But
he is 100% right.
Right.
People are too wrapped up in their own lives, and no one is making the time for this stuff. But we're not going to have a country, folks, if we don't make the time for this stuff.
And you should understand it's great to listen to people who tell you certain things or give their opinions.
Yeah.
But it's also valuable for you to give your opinion.
Yeah.
You know, you shouldn't just listen to somebody's opinion.
Right.
You should also give your opinion.
Right. Yeah. No. And you know what? Opinions change.
Opinions change.
Sometimes
That's right.
you may start in position A, and once you've gathered some more information, you could flip.
That's right.
With good reason. I'm not saying for the wrong reasons.
Right.
It could go either way, I suppose. But
Right.
sometimes knowledge is power, and with more information, you've now taken a different position.
No question about it. No question about it.
Yeah, but I mean, these are the principles that our great country was founded on. It's so vital to have a voice and cast your vote. That's really what democracy is all about.
That's what it's all about.
I just feel like we've gotten so far off the beaten path, and the information age, for all of the wonderful things that it's given to us, it can also be our demise if we're not careful.
I agree
with
with you.
people getting their info on their news from Facebook. Not the best, I'm not saying it's all wrong or all bad, but you might not want it to be your only source.
Have more than one source. Exactly.
For sure.
That's exactly right.
So for folks that are interested